Hey everyone, so we're going to be covering urban health today. Butembo will be starting with discussing news and events related to urban health, as well as how international organizations are addressing it.
Hello everyone, my name is Butembo Jonathan. I present a justification of urban health as a hot topic for the global health course, but also as a global health priority. I also present on current events and reports that are related to urban health. According to the WHO, over 55% of the world's population currently lives in urban areas. This proportion is projected to increase to 68% by 2050. Now, increasing urban populations have adverse effects on urban features, mainly the physical and built environments, the urban infrastructure, social environment, and existing social resources, which in turn influence urban health. Because of increasing urbanization, urban features are mostly characterized by substandard housing, traffic congestion, poor quality water and sanitation, inadequate infrastructure such as schools and hospitals, and inaccessible commercial, public and green spaces. These dysfunctional urban features influence health risk factors, including physical inactivity, poor diet, water and air pollution that are associated with NCDs, mainly cardiovascular and respiratory diseases, cancers, mental illness, violence, and injuries, including road traffic injuries. Additionally, urban characteristics, especially housing and transport, easily perpetuate the transmission of infectious diseases, as has been revealed by the COVID-19 pandemic. Because the burden of NCDs and infectious diseases disproportionately affects urban populations in terms of morbidity and mortality, renders urban health a hot topic for this course and a global health priority. The first UN Global Summit on Urbanization, which was organized in 2016 by the UN Habitat and the UN Agency for Housing and Urban Development, set global standards of achieving sustainable urban development through the Quito Declaration on Urban Cities, on Sustainable Cities and Human Settlements for All. And through this declaration, the new urban agenda was developed that urged national governments to rethink the way urban cities are built and managed, and to leverage existing stakeholders within urban settings, including the private sector and the civil society, as well as local communities in managing urban health. The Urban Health Rome Declaration of 2017 promoted intersectoral approaches and health promotion policies as strategic aspects for enhancing health and well-being in urban settings. The declaration also set strategic actions to improve health in cities through a holistic and multi-sectoral approach that promotes health in all policies and health promotion within the urban context. Additionally, the 17th Urban Health International Conference 2021 on transforming urban futures was based on learnings derived from the COVID-19 pandemic. And the conference set out major issues that national governments need to work on, including health inequities, improving the built environment, and strengthening urban governance and public health systems, as well as addressing climate change and urban health. These are some of the initiatives currently related to urban health, among others. Thank you so much. Hello, everyone.
Hello, my name is Lisa, and I will be going over the urbanization and urban health across world regions. So as you can see in the chart on the right, Asia and Africa will see the largest numbers of urban residents and fastest growth of urbanization, which will then patterns and pace and causes of urbanization will vary across geographies. While many cities will continue to grow, pace is expected to slow, and many other cities are looking at declining or aging populations. These trends are important to monitor and understand for policymaking and investment priorities, such as public spending, infrastructure investment, and urban design, based on the projection of these urban decline, this urban decline and growth. In regions like sub-Saharan Africa and Asia, population growth is outpacing city infrastructure, causing for concern in access to adequate availability of clean piped water, improved sanitation, housing, and paved roads, especially in already poor cities. As a result, this would lead to expansion of slums, where a majority of the city residents in Africa and South Asia already live. In 2014, the UN estimated 881 million people in lower income nations live in slums, and by 2030, it is expected to reach 2 million globally. Lower income populations around the world are considerably healthier than they were in centuries past, as they have been global improvements in mortality and treatments for traditional diseases such as cholera, tuberculosis, diarrheal, and intestinal infections. And although these improvements have been made overall, it can still mask the health disparities and inequalities that still exist, causing an uneven distribution of health through high burden of disease, injury, premature death, and poverty among poor city residents. In sub-Saharan Africa, it is the fastest growing and youngest region, seeing a youth bulge. So it is the highest urban growth rate, but only 39% of the population live in these areas. The growth is due to natural population growth with 60% versus rural to urban migration, which is 40%. Most of the urban population growth in smaller cities rather than larger ones is a trend that we see within sub-Saharan Africa, and low level of it is a low level of per capita income. So there is no economic growth nor poverty reduction, and their GDP per capita is less than 3,000. So we can see that there is an rural urban gap in poverty, and it has narrowed between 1990 and 2010. We could see these in African cities such as Mozambique and Uganda. And the narrowing is actually mainly due to a rise in urban poverty. Rapid unplanned urbanization is linked to the poverty, which leads to food price inflation, increased non-communicable diseases, and economic growth, as mentioned, as having trouble keeping pace with the population growth. And with a big youth bulge already happening, there will be a large demand for labor that may not be available. We also see that climate change is affecting decreased agriculture opportunities due to water scarcity, which is why there's such a migration to cities. And opportunities and challenges that we see within the sub-Saharan is prioritizing investments in job creation, education, adequate housing, and services for better opportunities and quality of life for rapid growing population. And this is just showing a chart of the youth bulge that we see in the sub-Saharan Africa. Now, in East Asia and Pacific regions, it's also rapid urban growth right behind the sub-Saharan Africa. 50% of it has already been urban by 2018, and urban growth is common within it is growing among subregions, and secondary cities are on the rise. There's low fertility rates and steady increase in life expectancy. Pollution and migration have significant roles within these regions, and anti-migration policies contribute to inequities. So with increased life expectancies, elders often face increased financial insecurities and ill health. So increased likelihood of non-communicable diseases, elderlies continuing to support themselves by working, and putting themselves at greater risk to work injuries. There's prolonged exposure to air pollution, which is linked to poor health and impact levels of disability. Elderlies in richer cities are more affected than those in poorer cities, just because there's a lot more pollution exposure within these cities. And secondary cities face development challenges. Lack of funding, which leads to a lack of basic infrastructure, low capacity of local official impacting safety, and resulting in concentrations of urban poverty. There has been an internal boost from rural to urban settings to secure more predictable income than the risk of uncertainty in rural agriculture. And the household registration policies we are seeing in China, Vietnam, Mongolia, Indonesia, that creates a class of undocumented citizens, which blocks access to government services and risk of work exploitation. Eastern Europe and Central Asia, there has been a decline in urban population in more than half of low and middle income countries within this region between 1991 and 2011. Population is rapidly aging across the capital cities with decreased and declining fertility rates. And within this region, there's also a high number of refugees and internally displaced populations. So refugees and asylum seekers within this region, 10% of the world's refugees are in Eastern Europe and Central Asia, resulting in a large unemployment rates, food insecurity, which leads to malnutrition and lack of access to education and healthcare. Also, as population gets older within this region, there will need to be a change in urban shifts. So there should be a focus more on health versus education, and ensuring accessibility and promoting inclusiveness in development of urban public spaces and communal gatherings. Gender differences in mortality rates is also high within this region, which is leading to high widowhood, and therefore policies for effective pension systems for this population group should also be a priority. Latin America and the Caribbean, it's the most urbanized region, reaching the majority by 1960. The average growth rates of cities are declining, and urbanization is shifting to smaller cities. Rapid aging is also happening within these urban areas, and there's an increase in old age dependency. There's also large-scale migration seen within these regions and high crime rates in certain cities within Latin America and the Caribbean. But in terms of the large-scale migration movements, 20% of the population growth, there has been 20% of population growth in Colombian cities because of the recent Venezuelan migratory movement due to political turmoil, socioeconomic instability, and the ongoing humanitarian crisis. Other cities with high Venezuelan migrants are currently Ecuador and Peru, which puts high stress on infrastructure and service delivery. Also, there have been high crime rates in certain cities. So Brazil is one example where there have been high homicide rates. In 2011, 10 of the biggest cities of Brazil were 3.5 times higher than the national average. Urban trends within this region will put pressure on healthcare and social protection, with the rise of older population overwhelming the system. Improving urban spaces, infrastructure, and basic services to create better connectivity, improve service delivery, and mixed-use developments should be a priority within this region, and finding a balance to work for growing aging population and retaining and attracting the younger population. Middle East and North Africa have the high rate of urbanization with a rate of 64%, but growth rates are declining. There is also a rising youth bulge and likely to stabilize in the future, but can potentially lead to higher growth rates, especially in urban areas. Again, the Middle East also is has a high rate of refugee and urban displacement. There is unbalanced spatial development and high conflict climate-induced migration. There's lots of forced displacement, mainly in Syria, Iraq, and Republic of Yemen. It's the world's largest number of forcibly displaced people. And in 2016, approximately 1/4 of the world's 65.6 million displaced people live in the Middle East and North Africa. Middle East and North African countries also are facing climate change, where there's a lot of water scarcity. So that is also leading to migration in urban cities. And there's a high youth unemployment rate that can be challenged with the rising youth bulge. The imbalance in economic activity and access to services is also highly due to the unbalanced spatial development, creating disparities and inequities on education, wealth, and gender. On the next slide, that you would see the unbalanced spatial development that is shown here on the chart. And then next, we will talk about South Asia. The youth bulge, once again, is due to reduced infant mortality and falling fertility rates. There is high unemployment rates. It increased from 3% in 2010 to 34% in 2017. Urban population growth is mainly driven by natural growth rather than rural to urban migration. And there is high congestion and low livability, which leads to crowding, pollution, and favorable grounds for infectious disease. Also, South Asia faces gender disparities since there are more men than women, and it affects women's labor force participation and marriage rates, which then causes gender-based violence, burden of childbearing, poverty, and sex trafficking. And the next graphs, you could see how much more, how high congested the density population is in South Asia in comparison to the other world regions, including also to the density and how there is low livability in South Asia.
Thanks, Lisa. Hi, everyone. My name is Cheyenne. I'll be talking about the global action that's being taken on urban health, as well as the challenges faced by stakeholders, including international agencies, governments, and so on. So to start, national urban policies aim to assist national governments to assess programs in key areas, and these include climate resilience, zero carbon transitions, SDG 11 progress and intersections, and so on. They also have the potential to address urban waste management, access to renewable energy and energy efficiency, upgrading and financing urban infrastructure, job creation, decent work and youth employment, resilience and adaptive infrastructure, access to drinking water and sanitation, urban safety, rural-urban linkages, and land tenure security and resilience. And next, the WHO UN Habitat collaboration sought to address the following themes, including urban planning and health, NCDs and injury and prevention, environmental health, emergency preparedness and response, health and migration, environmental management of vector-borne diseases, safe, healthy housing, and safe and healthier diets. So these are just some of the global action that has been taken or recommended to national governments in order to address urban health and the subsequent issues. So now we will talk about the challenges for urban health initiatives in international development. So there's a relatively weak science base, and there has been a lot of push to gather more data to have a stronger science base in order to make more informed decisions. Secondly, there are massive geographical gaps in healthcare availability, as you saw in Lisa's portion of the presentation. And lastly, there's an inadequate understanding of interactions across urban systems. The overall disconnectedness of urban planners, local governments, as well as other city officials, waste management, and so on, cause issues of urban health to perpetuate and continue. So these are some of the challenges. And specifically, challenges faced by global systems, urban health caucuses require better organizations to compete with the many goals of the 2030 agenda. So there needs to be a push for unity and agreed upon priorities. As of current, there's no urban health equivalent to the migration adaptation strategy pushed by the climate science community through the Intergovernmental Panel on Climate Change. So without this equivalent, there's no, like I said, there's no agreed upon strategies or priorities. So it's kind of left up for interpretation, which is not effective. Lastly, as I briefly mentioned before, there's an immense isolation between public health officials and urban health planners, which is hindering the success of urban health initiatives. So to further critique this specifically, incorporating health and impact assessments among urban planners, making that a requirement amongst those who plan urban cities, would address this particular critique. But other things that can be done and by who include, we'll go into these in the following slides, ministries of health, local governments, and international agencies. So respective ministries of health, to cut it down to a kind of a shorter list, they can engage other sectors in conversations, including housing, transportation, industrial, water and sanitation, education, and financial agencies within their respective country. As I was saying, a major challenge and critique of current policies and agendas is the lack of interconnectedness. So this is a recommendation for that. They can also support health and environmental impact assessments for urban planners and, urban plans and policies, which also was briefly mentioned before. Local governments can foster collaboration within local governments across departments to discuss developing an urban strategy plan, which is similar to what I previously said, but on a more locality-based level. They can also partner with voluntary organizations, professionals, and community organizations to share messages of urban health initiatives. And lastly, they can share information and set up mechanisms for sharing data on active living. Lastly, international agencies can promote and support policies to encourage healthy environments. Probably most importantly, they can disseminate lessons learned from one part of the world to the other in order to see if those can be adapted to other parts of the world, which we'll talk about a little later in our presentation. Lastly, they can encourage policymakers to generate and use socio-demographic information to make better decisions regarding urban planning.
Thank you so much, Cheyenne. So my name is Rodina, and I'll be touching on the priority areas for action to promote urban health. The first point I want to touch on is promoting action through infrastructural investment, which is necessary in order to improve urban health overall. These investments will promote a green transition, which will in turn promote urban health in urban areas. There should be a basis for countries, cities, and communities to commit to renewable energy, sustainable production and consumption patterns, managing natural resources, food systems, and waste more effectively. It is also critical to refocus investments through an equity and inclusion lens and make sure that marginalized communities are not excluded from these investments and that their health is prioritized as well. At a country level, we believe that there should be a national approach to handling these investments. But in addition to that, cities should be able to readjust that based on their individual needs. However, nationally, cities should be held accountable to make sure that they are transitioning into inclusive and sustainable urban cities. At a global level, I believe it is necessary that international organizations such as WHO or the UN should increase investment in urban planning for health in their urban policies and specifically support middle and low income countries with policy building and infrastructural investments. At the end of the day, helping these countries become more clean and sustainable will help climate change, which impacts all of us. So promoting action through governance really focuses on policy building aspects of urban health. In order to have long-lasting, sustainable, and inclusive policies, all countries should develop urban policies that cover social determinants of health, such as environment, socio-demographics, education, housing, the economy, and geography. In addition to this, although these policies will focus on infrastructure, they should also still have a health lens, meaning health should be a priority in regards to all investments being taken to create a more sustainable city. Promoting cooperation between national, city, and local governments is also a critical factor. There needs to be some type of cohesion between states and how they are prioritizing urban health. There are certain criteria that need to be at the forefront of all of these policies and investments, which I stated before, but I do want to state again, which is the inclusion of marginalized communities and a focus on their health and well-being, since they have been excluded from this in the past. Also, partnering with non-state actors may help because these actors strengthen city response plans by bridging service provision gaps. They provide targeted assistance through direct cash transfers, food and other commodities, as well as participating in the production and distribution of health kits. An example of this is seen in Sao Paulo, Brazil, where there was a partnership between the city and a civil society organization, and they coordinated donations and volunteers to tackle the pandemic's social and economic effects. So I wanted to put this slide up because I believe Accra, Ghana is a perfect example of a city that is prioritizing urban health and taking the necessary steps to create a sustainable city. The Snapchat I took from the WHO page, but essentially it is touching on how the city worked with international and government experts to integrate health into transport, household energy, land use, and solid waste management policies. They mapped stakeholders and policies impacting urban environments, built capacity for effective engagement by cross-sector policymaking, and communicating effectively with the public on links between climate, air pollutants, and health. They used tools to assess the health and economic impacts of policies related to air pollution, and the identified sectors were evaluated and applied to the local setting. Lastly, they used alternative scenarios and policy options tested to help the sustainability of the work at the country and city level. I think other cities should definitely look at Accra as a model for urban planning. Next, I want to talk about promoting action through education, which is crucial to urban health on both local and global levels. As urbanization continues to become more and more common, especially in low and middle income countries, we need to make sure that they are aware of the urban health risks and are ready to mitigate these issues to ensure a sustainable future for the people in their cities. WHO states that well-planned cities can offer unique opportunities to create urban patterns that minimize health risks from air pollution, traffic injury, physical inactivity, while also mitigating climate change. All these cities should be able to minimize these health risks, but if they're not educated, whether at a national or global level, about health risks and how to adequately launch urban planning in a specific city, then they will be dealing with the consequences of poor urban health, which will be deaths related to non-communicable and communicable diseases that emerge due to an urban environment. And they'll also have to address the inequities within this. I included this image to show how urban health is related to the SDGs. This image also does a great job of showing the intersectionality between urban planning and public health. There are so many factors of urbanization that impact health, and it is necessary for city planners to recognize and understand them so that they're able to create sustainable solutions to address them. Thank you all for tuning in on our presentation, and we look forward to answering your questions.